We turn now to the mandate, and I'm going to invite Bill McCarthy to introduce the paper. Please, Bill.
Thank you, Chairman. A very important piece for the board, and it's a discussion that we've been progressing over the past months, and we've discussed it here before. The mandate, to remind us, is the agreement between the Department of Health and the NHS Commissioning Board, which will set out the government's objectives for the NHS in England. So getting it right and getting it set with the right tone, the right framework will be very important, not just for us, but for the whole NHS. The lens through which we've been looking at the mandate consistently as a board is, first of all, this needs to be about patients. This needs to be about the ambitions that patients have to improve their outcomes, and it needs to be about the NHS's commitment to the NHS Constitution standards, which give the reassurance to patients about the services that they receive. So that's, I think, our preeminent perspective on the mandate, and has been throughout. Secondly, I think picking up on the item that Barbara's just led us through, is the importance of making sure there's enough headroom in the way the mandate sets out our objectives to ensure that that real clinical leadership, the innovation, the creativity, the capability that we're investing so much time in supporting is got the headroom to make the right decisions with the right relationships locally to bring about the outstanding services that we all want. So the right focus on outcomes for patients and the right degree of freedom for clinical leadership locally is the perspective we've taken so far, and I suggest to the board the perspective that you'll want us to use when we're commenting on the mandate over the next period. So it's an important point now because the department have just put out a draft mandate for consultation. Now we are being formally consulted. The period of consultation goes on till the end of September. I would have thought we'll want to express a view well before the end of that period. Here's a chance today for the board to give us an initial steer on the work you'd like us to progress over the next month in putting together a really clear and robust response to the consultation period, which has those principles around patient and clinical leadership at its heart. Open it up for discussion, Chairman.
Thank you, Bill. I think it's impossible to underestimate the sheer importance of this as a document. We're entering into an era which is unique, not only in terms of the development of the NHS in England, but internationally. It's a new model of healthcare. We're moving into an era in which an independent board has been established, and its competencies have actually been defined in statute. That is a first. Secondly, the relationship between the political accountability to Parliament for the NHS and its day-to-day operation is quite clearly separated in the statute. So the Secretary of State retains overall accountability to Parliament for the performance of a healthcare system in England. But we, the board, have concurrent responsibility with the Health Secretary for the promotion of a comprehensive healthcare system in England. And to have that responsibility in turn necessitates the measure of autonomy that will make it work effectively. That autonomy is established, first of all, by the terms of the legislation itself and the regulations that will be made under the regulation. Secondly, and absolutely critically, by the NHS Constitution. And we, I think, are the operational guardians of the NHS Constitution. I don't think I can possibly put it higher than that. That's where the responsibility lies. And then thirdly, the mandate. The Secretary of State loses the power to give directions in respect of the day-to-day operation of the National Health Service in England. Our responsibility is for that operational command, but also the Secretary of State is entitled and indeed obliged by the legislation to set the high level objectives, the outcomes. And the essence of the approach to this is to try to balance how we can in this country maintain a political responsibility for an excellent healthcare system through the mandate specifying for us what our outcomes must be, and at the same time empowering us to take process choices that may not be any longer prescribed centrally and which allow us to via between different ways of doing things, but not just us. We, of course, have direct responsibility for direct commissioning for primary care and for specialist care, but the bulk of commissioning is through the CCGs. And through the CCGs, whom we, in that last session, have undertaken to develop a partnership with and an enabling relationship with, require, as we do, as much autonomy as is consistent with proper conduct, but with the delivery of the highest possible outcomes for the benefit of patients and carers and other stakeholders in the health service. So the role of the mandate, to my mind, is one of being very tight on outcomes, but being relatively loose on process, to allow those choices to be made which involve inevitably trial and error, the taking of risk, the making of mistakes. It's impossible, I think, under a liberated NHS where resources are aligned with clinical judgment through CCGs, to have a tight central national top-down prescription of process. So those, I would commend to the board, are the principles which we should be thinking our way through as we consider the appropriate response to the draft mandate that we've got. And I would say to the board that there are areas of this which I think completely fit with the government's objective of liberating the NHS and of being clear about the outcomes in the 5 key domains. There are other parts of it where we might find that the mandate goes further than we would have wished, and I would hope that we will, over the coming weeks, have an opportunity to review those parts and to have constructive discussions with government and with other stakeholders as to how we can ensure that we do deliver the government's overriding objective for the mandate, which is a liberated NHS and greater clinical leadership aligned with resources that can advance the health outcomes for the people of England. Let me take observations on the paper and on the draft mandate that colleagues have seen. Kieran.
2 things which pleasantly surprised me. One was the mental health side of it. I think the recognition that people with mental health difficulties also have poor physical health, and people with physical health issues can have their mental health impacted. I think that was good. The other one which I think is important is maintaining this line around not putting all our favourite hobby horses in, speaking as somebody who has favourite hobby horses. And I think if we are going to achieve some of the things we have to achieve, that what we want to do in cancer or diabetes or Alzheimer's or anything else gets implemented really needs to happen through the relationship between the commissioning board and the CCG. So I think it was very encouraging not to see that in, and I think part of our response back needs to be to support that line, because if we do all put our hobby horses in, we'll only get some of them in anyway, and then we'll all have to go delivering this particular thing on cancer and that particular thing on Alzheimer's as well. So I think whatever we need to do in our response to get that across, the importance of that and the risks it creates to the whole system if actually we have a second outcomes framework lying on top of an existing outcomes framework, I think that would be very, very difficult.
Victor?
I think the key thing for me is the inequalities, because that drives a whole load of measures and outcomes that which will be very visible to those patients receiving health and social care. So I kind of welcome it, and looking at it, what worries me a little bit is that it doesn't say. On the one hand, there is an awful lot in these documents that really aren't about the mandate, like choice, for instance. I mean, there's a lot of stuff in there. And I think we should welcome the one big thing that's in there, which is the thing about inequalities, reversing the inverse care law. I think we should question some of the stuff about choice. I'm not saying it shouldn't be, but it's sort of the mandate and the choice documents are all lumped in the same thing, and I think that's a bit confusing. And I wonder how we can, I know there's been discussion about this, but I wonder how we can coordinate or find out how the CCGs are going to respond to this, because if they come out with a different response to us, or a vastly different response to us, then I think that causes problems.
I mean, it seems to me, Chairman, you start off in I thought we start off with a really good position, which is we want to steadily improve, or in some cases significantly improve outcomes for all of our patients, not just some of them. You want to continue to develop and improve the relationship between the NHS and the NHS Constitution and how it impacts on it and patients. And you want to do that at the same time as providing universal healthcare free at the point of use, tax funded, etc. So you start with that, and then you add to that the philosophy of liberation of taking decisions very close to patients, and patients themselves taking more decisions about themselves. You add all that together, and that takes about 4 minutes to say. But when people try and write it down, it suddenly becomes quite difficult. And I think that's where we need to help the department think this through, because it seems to me potentially this is an enormously powerful communication document for both the government and ourselves to set out to people in a way that they can understand what they can expect from all the hard-earned taxes that they pay for the NHS. And I think there's something here that we can work on, but I think it is some way away from where we need it to be. And the second thing I'd say about it is that where you have what in old terms might be described as process-driven targets, we need to be really clear about why and how and what for and what the benefit of all of that is. Just listing things down with no justification, I think, is quite a difficult thing to communicate and work with people from. So I think we can work on this document, work with the department, and get it into a much better place for patients and, of course, for the system that we want to run.
Thank you. Maggie.
Well, I'm glad to hear your view on that, David, because I think that was my reaction in reading it, is as a non-NHS expert person, you sort of get lost in the document because it's become quite dense and complex. And I think if it's a document that should be capable of being read by members of the public who are interested to understand the mandate, it needs to be shorter and more simple and more to the point. And I think what you just described is exactly the direction I think it should go in.
Myra?
Yeah, I couldn't agree more, really. It seems to me that we've heard about the stresses and strains that people are undergoing to change the structures, as it were, to allow this liberation to deliver better for patients. But this needs to signal that they believe in that culture change and that opportunity, whereas actually the message it sends is do everything that you've done before in the same way, and here's some more things that we want you to do. So I think it has to signal a change, and it doesn't hit the mark, even though there's lots of things that, we all do have our particular pet subjects that we want to see there. But I think we do, as Karen says, have to restrain that desire in the interest of that overall message, that somehow or other the public will get finally what this is actually intended to achieve.
Jim?
It's not a sort of slightly presentational point, which is the danger when you read it that it feels like a list of important incremental objectives. One of which, by the way, is continuing to deliver efficiency savings for the coming period. The sum total of all those is a transformational change in care. So it's a document that will signal for us and the wider service, significant process of, I think, positive but quite profound change in implementing these things. It won't come about simply by incrementally addressing each of those in turn.
Because I was just thinking of the word, we keep on hearing this word change. I was really just to echo Jim's point. If this document does not effectively provide the kind of the manifesto for a very, very positive but real disruption in a way in the service for patients, then we've just lost a massive historic opportunity. I mean, what this should be doing is underpinning, a programme that will deliver vast and real transformation, is the word, in customer services, for patients. And I absolutely agree, this just doesn't capture that at the moment. And I think we can, as David was saying, I really hope we can help the department express this in a much more accessible and real way for people who are engaging with the NHS, and indeed for the staff of the NHS as well.
Can I say I'm immensely heartened by the comments we've had around the table, because I think there's a great seriousness of purpose here. Just to emphasise again, it's unique, not only in healthcare systems, I think it's unique in terms of being the first time in 64 years that the British government have been required to spell out, or have imposed upon themselves the requirement of spelling out what their expectations are of the NHS, and not just for 1 year, but for 5 years and for 10 years. Given that it's so unique an opportunity, it would be immensely powerful as a document were it to seize the transformational agenda and to understand that the whole point of these quite difficult reforms has been to transform the quality of healthcare for patients in England. And to include patients as part of this, I think, is immensely important. In other words, a document that is immediately accessible, a document that sets out quite simply what the high-level objectives are. I think we could work very closely with the department to assist them in coming up with something which could be not more of the same, but something, dare I say, quite inspirational and transformational. So may we work with your approval on a response and close working with the department to see where I have to say I think there's quite a close convergence of view. What we're thinking about, I think, is the approach and the means of expression, given that this is not just as it were, a slight turning of course, but a quite radical change in direction. Thank you very much for that response.